So much for having me, Dina.
I want to definitely talk about COVID and the COVID boosters, but first I want to tap into your knowledge, of course, as a pediatrician. We're seeing a number of respiratory illnesses crop up for younger children in August and now through September, filling up the hospitals. Can you talk about that? What do parents need to know? Many are already concerned about COVID for their kids.
Well, I think it's important for all parents, knowing that kids are going back into school. Many are sort of interacting with kids and friends and families again, that to be really sort of aware of making sure that all the prevention, hand washing, other things like that, to ensure they're being as healthy as possible. We did send out a little bit of a message about kind of a new virus that's coming through, and we've seen cases in other states, but not in Illinois. That's a little bit sort of enhanced kind of cold virus that has the possibility of causing kids to get a little bit sicker. It's called enterovirus. And so I think it's a place for us to be a little bit aware of, but really it's more of just the standard cold viruses sort of coming back as school has started. And we want to just ensure that people stay as safe and healthy as possible and do all of the hygiene protective things that we have learned during the COVID-19 pandemic.
Right, and all of those things will help protect us from COVID. As we move indoors in the fall and the winter months, how worried should we be about a resurgence of some really dangerous cases of COVID?
So I think we're all trying to be aware and prepare for potential increased cases of COVID-19 as we enter the fall and winter seasons. But the good news is that as we enter kind of this new phase in the pandemic, we have so many available tools, including the latest being an updated new bivalent booster that has sort of protection from the enhanced Omicron subvariants. And so anybody who is over 12, and we recommend from the Illinois Department of Public Health that anyone who is over 12 who has received the initial series or their latest booster, and it's been 2 months since they've received that, they're eligible for this new bivalent booster, and we recommend that people get those as soon as possible. It's also never too late to kind of start getting your initial vaccine series. And so we always say we always want people to stay as up to date as possible to enhance the protection from COVID-19.
If people have recently been diagnosed with COVID, is there any issue with getting this new vaccine?
Well, I think partly it's always a conversation that you want to have with your physician and clinician. But part of it is that as long as you haven't had a previous booster, kind of 2 months previous, you're eligible, and we want people to kind of think through and get as much enhanced protection as possible.
Are there any different side effects or any concerns at all about this vaccine?
So, this vaccine, just like any kind of continued series, has been monitored through and received authorization on in early September from the Food and Drug Administration. So we know that it's safe. It sort of has just some of the similar side effects. You'll have kind of a little bit of bruising on your arm, maybe sometimes just a little bit of just minor kind of symptoms similar to the previous COVID-19 vaccines. And so again, limited side effects, and we encourage everybody to get as vaccinated as soon as possible.
Okay, and we have enough supply in Illinois. Anywhere we went before to get our vaccines, we can get them this time.
Yeah, we have enough supply. So I think the biggest thing is we got 500,000 doses in our first week. And it's really a great kind of tool is www.vaccines.gov. And we encourage people to go there. You can place your zip code, and you'll be able to find the closest site in which to get the latest COVID-19 vaccine booster, or even the initial series if you haven't gotten any vaccines up to this point.
Perfect. That's helpful as we head into the holidays. We all want to be together with family again. Dr. Samir Vora, thank you so much.
Thanks so much for having me, Dina.